Hi, I am Dr. Virendra Budnoor, consulting orthopedic surgeon with Apollo Spectra Hospitals, Kondapur, Hyderabad. I am specialized in joint replacement and arthroscopic procedures of the knee, hip and the shoulder. Common sports injuries in young adults are usually of the knee and the shoulder. In the knee, the injuries are usually of the ligaments, that is the anterior cruciate ligament, the posterior cruciate ligament, or the ligaments on the sides which are called as the collateral ligaments. They might also suffer with injuries of the meniscus and the cartilage. Whenever an athlete has an injury, he usually complains of pain and swelling. If it is a simple pain and swelling, he needs to take simple rest, ice fermentation, and a little bit of physical therapy with non-steroidal anti-inflammatory drugs. Usually with this, the patient will feel better in about week to 2 weeks. In case the pain persists beyond, and if he has a sensation of sudden catching of the knee or losing balance when he walks and runs, he must be having one of these injuries. He has to visit an orthopedic surgeon. On examination, we will find out if he has got a cross ligament instability. We might advise certain tests like X-rays and MRIs and sometimes CT scan to know the nature of the injury. Depending on the nature of the injury, if it is a ligament injury, he would definitely require a surgical procedure which will be usually either repair or reconstruction. If it is a repairable injury, we usually repair it with the help of screws or suture anchors. In case if it is not repairable, we would reconstruct or put your own tendons and convert them into ligaments with making bone tunnels on either side of the bone and fixing it with the screws or buttons. This would be done with the help of arthroscopic procedure, which is a keyhole surgery. It is usually a day case surgery wherein the patient has to be getting admitted on the same day, operated on the same day and discharged on the same day. Later on, the patient is put on a physical therapy for about 6 to 8 weeks. Later on, there will be significant strengthening exercises for the next 4 to 6 months. Usually, the sportsman can get back to their sporting activities by the end of 6 to 9 months if the rehabilitation is good. Coming to the shoulders, mostly shoulder injuries are usually of the rotator cuff injuries where there is a traumatic rupture of the rotator cuff tendons. These are the important muscles which are supporting the shoulder joint. The injuries of the shoulder joint can also be treated with an arthroscopic procedure wherein we do an arthroscopy of the shoulder joint, assess the joint. If there is a labral tear or a rotator cuff tear, we repair them with the help of suture anchors. Again, post-surgery, the patient would require physical therapy for about 6 to 8 weeks, followed by strengthening exercises for about 6 months. Usually, the sportsperson can go back to their sporting activities by the end of 6 to 9 months. Thank you.